Welcome everyone to this AHDB webinar this evening. Before we get going, I just want to run over a few housekeeping points for everyone so the webinar runs as smoothly as possible for you all. The first point is that everyone, apart from our speakers, are set to mute. So if you would like to ask a question during the webinar this evening, please use your question box to submit it. And instructions on how to do this are on the screen at the moment. We're aiming for the webinar to finish at 8 p.m, so we'll be with you for the next hour or so. We welcome questions, and you can submit a question at any point during the webinar, ready for a short Q&A session at the end. Attendance on the webinar does count towards your Pig Pro record. If you provided your details when you registered, then your attendance will automatically be added onto it for you after the event. So just to help you understand who we have hosting our session this evening, my name's Pat Loughton and I work for AHDB as Knowledge Exchange Manager for the Central Midlands and the South of England. I've been with the organisation since 2018, and before this I worked on a large outdoor unit, so I've spent my entire career working in the pig industry. Our guest speaker today is Dr. Lysan Eppink, joining us from the Boehringer-Ingelheim team. Lysan graduated from the University of Ghent in Belgium with a DVM in veterinary medicine. After moving to the UK, she became involved with the University of Edinburgh, where she lectures in swine medicine. Lysan joined the swine team at Boehringer-Ingelheim in 2010 as technical advisor, and it's in this capacity that she's online today to give an in-depth overview of the best use of medicines, vaccines for pig production and caring for medicines so you get efficient use for them. So I've done enough talking now, and I'm going to hand over to Lysan, and I'll come back in at the end with any questions that you may have asked during the course of this presentation. Over to you, Lysan.
Thank you, Pat, and thank you very much for inviting me to do this talk for you guys. So if the screen is working, you will, there we are. We will see the first slide of my presentation, and somebody else will be moving the slides for me. So every now and then you will hear next or something. So if the animations don't quite work with me, just bear with us for a bit. So if you go to the first slide, you will see the best use of our agenda of what we are going to be talking about. So why not just medicate, why we do vaccinate and all that sort of stuff, because we will be talking mostly about prevention today, as Pat already indicated. If we can go to the next slide. Okay, and again, so we'll start off with talking why we don't just medicate, because that is obviously very easy. And the simple answer is that prevention is always better than cure. Next one, please. So when we are talking about cure, if you compare it to a house being on fire, it's obviously the antibiotics, which most of the time we're talking about pig medicine, will come out like the fire brigade. So a lot of damage is already done, be that in the lungs or be that in the gut. And it takes time to get that all back up and running. So even though the clinical signs, in this case, of the picture, the fire, is already out, obviously the house is still down, the guts of the pig are still damaged, or the lungs are still damaged, and so it will still cost you money even though the flames are gone. Next one. So prevention would look more like a sprinkler system, and as we'll see, is obviously we would ideally prevent the fire happening right away, but that is not that straightforward to do, as we'll see later. So next one, please. So if we look at pigs, so these are pigs from France, they're not our pigs, but you can see this is a typical case of something like an ileitis or what have you, where the pigs are very uneven. These are all pigs from the same age group, but they are getting some medication to try to, deal with whatever pathogen in this case is bothering them, or that's what we assume because we're medicating them. If you do the next slides, you will see what the pics ideally look like. So again, these are not our pics. You can see, if you've got a very keen eye, that these are castrated males as well as females. So they're European or American ones. But you can see that this is the picture that we all love. Pigs are very, very even. So this whole batch could go straight to the abattoir all in a one, more than having to empty them out over time. So compare that to the previous slide where we saw the cure rate, you would have some unevenness because you can only cure once you start seeing clinical signs. But we want to stop things, before they get to that sort of stage. So if you do the next one again. So to talk about a little bit about healthy animals and when they go sick. So if you hit enter, you will see if we've got pigs, it's a balance between the bugs. So a bug comes in, and it depends on certain things whether we get the next two animations, whether we get healthy pigs or whether we get sick pigs. And there are certain things that we can influence that by management and making sure that they're getting the right nutrition, etc., as we'll see in the next slide. Where we can see the three components, just do the animations there. So we've got the environment, the host, and the bugs or the pathogens themselves. And we'll look a little bit closer into how these all work together later on. But generally, pigs are absolutely amazing, and things will only go wrong when you get both the environment working against you and the bugs and the host. So if you hit next animation, you will see that little circle in the middle where you start to see clinical signs. Where there's two overlapping, you might get subclinical signs. Unless you do very careful monitoring of your production targets, you might not actually notice that much, whether your average daily gain drops by maybe 10 grams a day or your feed conversion goes up 0.1. A lot of people can't measure that properly. So we only see disease, if you hit the next animation, when it's in that middle. And that's obviously what we want to avoid altogether. So if we look at the difference, thank you, Becky. So all these end results is, even though you like to blame a lot on the box, if you do the next animation there, is what we have as outcome is 90% of what we do to the animals or to the housing or to the air quality or what have you. And only 10% is purely caused by pathogens. Now, there's a few exceptions to that. So let's say if we get African swine fever, or hopefully not, but if we get that, it doesn't matter what we do because the pigs are going to get sick and they're going to die. We can't do anything about it. But we can probably, if we've got PRRS or we've got mycoplasma on farm, we can work with those pathogens if we do certain things. And some of it we'll talk about later on. So next slide, please. So if we look at the host itself, there are certain aspects that will have an effect on or an impact on whether the animal gets sick or whether it stays healthy or maybe goes subclinical. So obviously the number one is the overall immune status. An animal that is already sick with something will be less capable of dealing with another infection. So an animal that's already got the flu, if it gets PRRS on top of it or blue ear, obviously it's going to suffer far more than when it's just dealing with the one or the other. There's also that little bit that these pathogens actually work together to make the animal more sick than they would be just on their own. Nutrition is essential. I think we'll all, know that people who are, the athletes that are on an amazing diet will always perform better than when those same athletes are maybe on just McDonald's or, Burger King diets. So nutrition is very, very essential. We need to have the right, the right formulation in the right presentation, etc., for the right stage of animal. And that might be, if you're talking about guts, that might be just not necessarily the age of the pig itself, but it might be more related to the age of the gut. So for example, if you wean a pig at 3 weeks of age, or you wean a pig at 8 weeks of age, even though the pigs themselves are older, the gut age is still the same because they've been used to that liquid diet mostly. And then we know genetic makeup plays a role. So we know there's differences in different breeds. We've seen that when we had circovirus before we had the vaccines, that certain breeds were more likely to go down with disease than others. And we know that there's a similar issue with, for example, the immune system. So there is genetic differences in them. Obviously, the genetic companies are looking in that sort of stuff, and we know there's natural mutations that we can work with. But obviously, there's some other things we can do, which currently, like genetically modified animals, which we can't work with. Next one, please. So the environment is where, what we do comes in quite heavily. So we know if animals are under social stress, so this is when you're mixing, when you're resizing, when you're moving, and all that sort of stuff. When the pigs are being stressed, the immune system will not be as efficient as normal. So something that could be generally shocked off quite easily. If they are stressed, they might gets a little bit sick, be off color for a couple of days if they don't get full-blown disease. Climate or air quality is massively important, especially when we talk about respiratory disease. So fresh air is just as essential as fresh water and a well-formulated diet. And it's something that we often forget about for one reason or the other. And then we've got the microbiological load, which is basically comes down to hygiene. Next animation, please. So that's all about the biosecurity, one of the components of the biosecurity, which we'll talk about a little bit later on. But that comes down to good old-fashioned hygiene. Reduce the amount of bugs that you've got, and your animals will be better to cope with things. So, for example, a little bit of Lawsonia, which is an infection, a bacteria that might give you ileitis, isn't going to be doing anything bad to the pigs. You won't see any clinical signs, but if you give it a shitload of those bacteria, they will get sick. So if we manage that, how much bacteria or viruses are floating around, we will be able to have an impact on how badly affected or how little affected our pigs are going to be. And then the management is obviously everything from all in, all out, continuous flow, or keeping age groups apart, etc., etc. And this plays a massive role on whether your animals are just this whole, a red circle, whether your animals stay healthy or whether they might go down with disease. So if you go to the next one, please. We'll talk about an example of where this comes in. So if you hit the next animation, still the green box comes up. So things like air quality. So PRDC stands for porcine respiratory disease complex. So what people, simple name is pneumonia. When your pigs are coughing and they're maybe blowing a bit or whatever, that's what we call PRDC. But it can be caused by a lot of different things. So if we just look at air quality in this case, we've got gas levels, aerosol droplets, and dust as a few examples. In gas levels, I'm, for example, thinking about the levels of ammonia. If ammonia reacts with water, you get a very toxic component. If the pigs inhale that will actually do damage in the upper airways, and you get actually necrotizing lesions from it, which then lets other bugs go in very easily and settle where normally the local immunity would just catch them and get rid of them. In this case, they can settle in and can cause disease, what's not normal. Aerosol droplets, I think we're all very familiar with that term these days with regards to the other virus that's causing a little bother at the moment. So they're basically tiny water droplets, and they can carry anything from a little bit of dust to mycotoxins to bacteria to viruses and what have you. And depending on how dry your air is and how your ventilation is set up, they can carry or travel for quite a long distance and further maybe than just the animal coughing on top of another animal. And then another thing that we all know, if you go into a very dusty shed or something, you automatically start to cough because it irritates your upper airway. It doesn't do any damage in itself, but you do get some coughing and some things. And a lot of the dust, the vast majority of the dust, is a result of the pig's skin cells being shed. So if you hit the next animation till you get the red box, please, what you will see is the sort of things that happen within a shed that are management related that will have an impact on, if you do the next one, on the gas levels, the aerosol and the dust. So ventilation, obviously massively important. If we know that dust is mostly skin cells, shed skin cells, we know that stocking density will have a major impact on the amount of dust. Obviously, how you've got your food, whether that is a meal or whether that pallets that will have an effect as well. But stocking density should not be forgotten. Temperature and humidity, obviously, if it's nice and warm and it is quite humid, then you're going to have more aerosol droplets. So these sort of things are all management related, which will make maybe the presence of a bug more likely to cause disease than when maybe the air is relatively dry and maybe not too warm. Next one, please. So that was just an example of what happens. And then the pathogens, we're talking again about biosecurity because we're talking about the amount of bugs, be that viruses or bacteria that are present, which is hygiene. The virulence, that basically means how damaging that particular virus or bacteria is. Some of them, there's a big difference between of them. Some other bugs that doesn't matter what you've got, they all do the same damage, whatever it is, and the mix of them. And a lot of that is, manage what you do have, but keep out what you don't have so that you've got a stable mix, that you don't get something more virulent in there. So you might have PRRS already, but you might have baby PRRS, as I refer it, so the one that doesn't do an awful lot. Well, we know there is some PRRS strains out there, here in the UK as well, that are more damaging than other ones. So that's where, again, the biosecurity comes in. Make sure that you keep out what you don't have, because we're talking about prevention. And if we've got something, we want to give the pigs the best chance to recover from the disease. But the best step is to prevent it happening altogether. So if you hit the next one, please. And a little bit about cost of infection here. So next animation, this is a study that was done by some French people in 2012, so nothing new. If you hit the next one, you will see a graph appearing. So, and I'll explain to them what they did. If you go back a step, please. So what they did in the study, they took a batch of pigs and they split them into two groups. And one group went into a house that was spotless. It was cleaned, it was disinfected, it was let to dry, etc., etc. And then the other house just had other pigs in it. So there was nothing wrong with those pigs. They were perfectly healthy, but it was, a bit mucky and a bit what have you. So just normal contamination, a bit like when you would just quickly scrape out and put the next batch of pigs in there. And what they looked at a huge amount of things. I'm only looking here for the sake of this presentation, average daily gain and feed conversion. So the first slide is average daily gain, and you'll see two lines appearing. One that is a solid line, and that is the clean housing, and then you'll see the dotted line, that is the poor housing stage. And you'll see how that sort of changed over time. And while it might not look hugely different, so some of those peaks and troughs that are out with, I mean, you will look into, if you want to read the paper, you can see why some of these things happen. But if you do the next one, please, you will see that on average daily gain, it made an 11% difference. Just the difference between a fully cleaned out shed versus a dirty shed that didn't have any pathogenic bugs in there, just the normal commensals, normal contamination. If you hit the next slide, if we look at the feed conversion rates there. So again, please, what you will see is the graph appearing there. So they look very similar. Doesn't look like a huge difference. And if you hit the next one, it turns out that there's only about a 7% difference overall. So that doesn't sound an awful lot. But if we translate that, if you see the next slide, into what that costs for money, so if we see the first animation, please. So that is just a calculation, a very rough and ready calculation of what a change of our feed conversion rate of 0.1 in finishers would mean. And basically, well, you can see what I've done there. We can argue about the cost of the feed and all that sort of stuff, but it is, for what I've roughly used, 1.63 a pig. Now, if we translate that to the next animation, please, to the change of 7% in FCR, that is going to be a difference of 2.75 pounds a pig. So if you're only a finisher unit and you've got maybe one batch of pigs in of 1,000 pigs every quarter, that is over 10,000 grand, just like that, by just having them cleaned out properly. And this is not something that these guys have found. I've heard several times farmers telling me, oh yeah, I mocked it out because they had a new toy for skippers to try out or something, and they knocked off a week of finishing. So you can do your own calculations there. So having those sheds cleaned out does make a huge difference, even though there's no disease. So you can imagine what sort of effect it would have, proper disease would have on these sort of figures. Okay, next slide, please. So we do know that disease reduces performance and profitability. Next one, please. And that is all caused because our medicine use is probably going up. So if you see diarrhea, you might just want to start using, if it doesn't clean up immediately, maybe use some antibiotics, or here's some coughing pics, you might want to start using antibiotics, whether there is a pathogen there or not. So your average daily gain goes down, as we've talked about. Feed conversion rate is going up, and that's costing you a lot of money because obviously feed is a huge part of your cost of production. The pigs will get more uneven, which will take you longer to finish out. You might have to sell some pigs lights, etc., etc., and your calls and your deaths are going up. So disease is overall a bad thing. And if you hit the next one, obviously an increase of medicine use these days is a very dirty word. We're blamed for everything anyway. If you hit the next one, and it's all to do with, and I'm not going into detail, but these, super bugs, as we all have heard plenty about. Not going into the whole argument because we will be here still by tomorrow, but it is a political debate at the moment. But we have to do our bit, and we have to reduce our use of antimicrobials, and we've done it already as an industry incredibly well. Now, some of that might be because we've just gone from in feed to in water. Next steps, obviously, in an ideal world is, making sure we don't even have to use them at all, because we have put steps in place that remove the need for treatments altogether. In 2022, there's going to be some new legislation coming in, which will make it very, very difficult for, preventative treatments will not be allowed in any way, shape, or form. Feeds carryover will be seriously challenged, so feed companies might not want to go there anyway. And obviously there's all sorts of other things that might be ongoing that we won't talk about too much, but there is going to be a change in what we can do and can't do. So next slide, please. But we all know that sometimes things happen, pigs do get sick, and we do need to medicate. We do not want animals to suffer. There is no, I'm totally against in not treating because we want to save our medicine. So we need to ensure that those pigs, because they're giving their all to us, they're giving their lives for us, so we need to make sure that they are getting the best welfare and the best treatment that's needed. So we all know we do need to medicate. So if you need to medicate, though, there's a few things to follow. So if you hit the next few animation, please. So only medicate if your vet has said that it is required. Strictly speaking, if you just got a viral infection, we all know if you've got the flu, as a human being, your doctor is not going to give you any antibiotics, because antibiotics don't work for viral infections. They only work against bacterial infections. So make sure that only use something if the vet has said okay, and that will become even more important so in 2022 when the legislation will change. If you're using something, if the vet says use something, make sure that you use what has been prescribed. So yeah, if you go to the next animation. So prescribing antibiotics, it's not like which bottle will we use or which color of pill will we use. There should be some art to it. There's different types of antibiotics. So some of them kill bacteria and some of them just paralyze bacteria. And we can work together. We can combine antibiotics from one group or the other group, but not from two of the groups, because that might increase in development of resistance. So there is actually, even though it sometimes might seem a bit random, there is a theory behind, there's science behind why we choose certain combinations of antibiotics. Obviously, we should have that knowledge for, strep suis, this antibiotics works well. And then we've got the farm knowledge specifically for your farm that we know, well, actually, yes, normally penicillin does the job, but we know from experience that, something else will work better. So we do or should use all that sort of information together. If you hit the next one, it is not just a matter of sticking in and making up, which one of my once upon a time clients told me. They knew that the dose was going to be 20 ml based on the body if for certain products, but they didn't have 20 ml of product X available. But they had maybe 10 ml of products X, they had 5 ml of product B, and they had another couple of mils from something else. And together they made up 20 ml. So surely that should be good enough. Antibiotics do not work that way. So if you hit the next one, if we are going to use any antibiotics, again, next one, please. Make sure that you use them as directed. Again, please. And that means with regards to the amount of antibiotic that you need to give, whether that is by injection or whether that's in the food or in the water, and duration as well. So sometimes we all know that the animals look absolutely fine after 3 days, but we know that from science and papers and what have you, that maybe after 3 days, yes, the peak of infection is over, but there's still bacteria there. So we might still need an extra 2 or 3 days to kill the last bits of the bacteria there. So if it says 5 days, do give it 5 days or whatever it is. And make sure you keep a record as well. That is not just because it's your legal requirement to keep a record, but it's also useful for us that we see, we had the strep suis problem there. We used that product. How did you get on? And you say, well, actually it worked brilliantly, or maybe not that great, and we can maybe adapt things. So it's useful for us as well to make clinical decisions on farm. So if you go to the next one, please. So prevention is always better than cure. I think, I hope that you will agree with me to that. So we have to talk a little bit about prevention then. Easier said than done. So if you go for the next one, please. We'll talk about a little bit about, vaccination, why we vaccinate, when we vaccinate, and we'll go a little bit off topic there for the initial bits. If you hit the next one, please. So what can we expect from vaccines? And the first thing is no vaccine provides protection against infection. So if you hit the next animation, so the only way we can prevent infection altogether is if we make sure that the air that the animal breathes in is sterile, that whatever he eats and drinks is absolutely sterile. So there's nothing that's go in, that the environment is sterile. If he's got a little skin scratch, that nothing can go in, which is obviously not realistic. They will inhale normal air, etc., etc. But we can do things to make that better. And part of that would be the biosecurity, to reduce the amount of dust, to have the best air quality possible, etc., etc. Next slide, please. So that's the first one to realize. What it will do, though, is will teach the immune system to fight off any infection very quickly. So by using a vaccine, we either give it a killed version of what's floating around there, or a part of a bug, or sometimes, like in the case of PRRS, we'll give them live but paralyzed sort of, in a way, viruses, so that they mimic what's happening, but they can't really do any negative effects. And what that does is that it builds up memory within the immune system, so that the next time when they see the field infection, they will get a response much, much quicker. So we've got not the same level of clinical signs, even if we even get clinical signs, etc., etc. So if you see the next slide, we'll see a picture of, just a comparison of what the immune system looks like before vaccination, and if you hit the next one, what it looks like after. I know which case I want to have my immune system in. If you hit the next one again. So also important to remember is that it's not an instant effect. So all these vaccines do take time, what we call the onset of immunity, to be at the most effective. And there is a little bit of difference between vaccines, but generally there's about 2 or 3 weeks time before we expect the immune system to be up and running to maximum capacity. With some of them, that is from if you're giving it for the very first time and it's a double vaccination, so one now and repeated, that onset of immunity is from the second vaccination. But it will all be in the data sheet. Next one, please. And again, so what we already said as well, no matter how well trained the immune system is, even if you hyper-immunize your animals, if the challenge is overwhelming enough, so massive amount of virus or bacteria there, the immune system can be overwhelmed and you can still get some clinical signs. Next one there, please. So keep that in mind. That is where your biosecurity comes in. So vaccination is a tool, but it's not the answer to everything. Next one, please. And the other thing is there's no such thing as a cough vaccine or a scour vaccine or anything. Vaccines have got one particular or sometimes several components in them, but they only work for whatever is included in the vaccination. So if you give a vaccine for Mycoplasma high pneumonia, which is parts, can play a big role in respiratory disease, it doesn't protect you against flu or against PRRS or anything or against coughing because of dust. So it will only deal or train the immune system to those specific bugs. So that's why you need to make sure that's when you start to vaccinate, that actually that bug that you're going to vaccinate for is actually playing, a big part in the problems that you see. Next one, please. So end result we already talked about. I think we know all that quite nicely. So keep in mind that a lot of it is what we do ourselves and not so much the pathogens. Okay, next one, please. So I have to mention this a little bit. This is the only slide about biosecurity, I promise you. But just to explain, biosecurity, it's not something static. It's something that needs to be developed and adapted and what have you. But basically what it is a risk assessment of the likelihood of you getting a new infection or your pigs getting a new infection or an infection that you already got, getting out of control and having a flare-up. So it's all about managing those risks and doing whatever you can to minimize those sort of risks. So for African swine fever, for example, bio-exclusion is massively important. And the best way is, make sure that no pork products get onto your farm. It's very simple. Obviously ignoring the fact that people might chuck bits of, ham sarnies or something over the fence. But generally, that sort of thing, keep out what you don't have is massively important. And then the biomanagement part of that is vaccination. You manage what you have. You make sure that you've got your pig flow well, that you don't, mix your age groups, that you do your hygiene well so that the amounts of bugs are as low as possible. And vaccination, part of that to, help the immunity become stronger to fight off any infection. And something that we sometimes forget is biocontainment. Keep to yourself what you have. So for some diseases, it's not that tremendously important, but if you've got dysentery on your site, keep in mind where you're going to spread your slurry and all that, because you don't want to give what you have to somebody else. Well, normally you wouldn't want to. Next one, please. So vaccines are part of a holistic control plan for some diseases. Just as long as you get it in the pig, you don't have to do anything else. Like most PCV2 vaccines are very effective in doing that. As long as it gets into the pig, it's fine. But most diseases, you need to manage everything else, as we already discussed. Next one, please. And again, so when do we then vaccinate? One of the questions is, why do we vaccinate? So if you can hit the next few animations, please. So we know prevention is cure, but we need to ask ourselves the question, prevention of what? Is that prevention of infection? We already talked about. Is it prevention of clinical signs? In which case we need to know, obviously, when things start to affect those pigs, when they first get exposed. Is it to stop local spread? These sort of things will all depend on, when we are going to vaccinate as well. So we need to ask why. It's also important then to manage your expectation of what the vaccine can actually do. So vaccinating your pigs for Mycoplasma high pneumonia is not going to stop them coughing necessarily. It will stop the damage that Mycoplasma does, but it won't stop them necessarily coughing, because that can be caused by many, many, many different things. Next one, please. So if we are going to vaccinate to provide passive immunity, so that's when the dams give on maternally-derived antibodies through the colostrum to the piglets, we want to vaccinate in late lactation. We want to do that then because we know that even though the immunity might last a little bit longer, we know top production of antibodies in the dam is going to be maximum 3 to 4 weeks before she farrows down. And if her antibody levels are as high as possible in her blood, they will be as high as possible as well in the colostrum. So we can't do that 8 weeks before she farrows, because then we will not get the benefit of the doubt. You also obviously need to make sure that your colostrum management is good, because the colostrum can be solid with antibodies. If the piglets don't drink it, it's still not very effective. But that again is another matter. So next one, please. So the next thing is, as we said before, infection is expected. Next, please. And we talked about the onset of immunity there. So it will take 2 to 3 weeks, depending on the vaccine and the pathogen, but you will find that information in the data sheet. Next one, please. So if we're talking about sows and we want to protect the fetuses that are in uterus, we probably want to vaccinate before mating, 2 to 3 weeks before mating. There is a little bit of a difference there between mass vaccination and stage-dependent vaccination. So stage-dependent vaccination is sometime in her production cycle, you will vaccinate. So typically, maybe for certain diseases, let's say PRRS, it was historically thought PRRS will only affect the gestation in the last term of their pregnancy. So that is where, the original vaccination at day 60 of gestation came from. Now that obviously works if you keep an eye on them, but sometimes they slip through the net or they return to service and what have you. So that's where sometimes mass vaccination, when you just do them regularly, the whole herd on the one day, might be better. So sometimes, even though we say mating, vaccinate them before mating, sometimes you get away with it mass vaccination if you keep vaccinating everything within that duration of immunity that we haven't talked about yet, but it is how long we think the vaccine will give protection, and that all depends on the disease as well, as several other things. Next one, please. So we're talking about, and again, if we are talking about pigs, obviously we want, because we're only concerned with pigs about the pigs themselves, they need to stay alive till we basically kill them. So we want to have them vaccinated 2 to 3 weeks before we expect your infection. And this is where we can be maybe start to become a little bit more clever with our vaccination, because most people will vaccinate around weaning, whether that's just before weaning in the crates or whether this is at weaning when you've got outdoor pigs, where you just give everything at once. But if we know, for example, with diagnostics, that at the weaner accommodation, the pigs are not getting challenged with, let's say, PRRS, they're only going to get challenged in the finisher site, maybe if we want to have the immunity to an absolute maximum, when they first get exposure, maybe instead of vaccinating at weaning, we can vaccinate 2 to 3 weeks before they move to the contaminated site, so that we've got maximum immunity when they meet disease. Now, I fully understand that there's labor implications and nobody wants to start vaccinating, 1,000 pigs when they are 40 kilos or something, but it might be a way to get more out of our vaccines. Next one, please. We'll skip this one. Next one, please. So with pigs, we've got that little bit of a gap there between the maternally derived, so you can watch that when you see it back at some point. With gilts, it's very important that we've got them fully immunocompetent before they join the main breeding herd. So whatever is floating around amongst the sows that are already there, the gilts will not be susceptible to them, or as least susceptible to them as possible when they joined. You also don't want those gilts to be shedding a bug anymore that they can then pass on to their own piglets or to the other breeding animals, and therefore maybe destabilizing the health of the breeding herd in itself. So if we think, for example, at you're breeding your own replacements, they're in the finishing sheds, and maybe they only get infected with mycoplasma, at 5 months of age or something, before just when you select them. We know with mycoplasma and PRRS that they will be potentially shedding for about 150 days. So strictly speaking, we know if the gilts are going to get infected only that late onwards, that they are probably going to farrow down when they're still shedding and passing on the virus or the bacteria to the piglets already, as well as to the sow that's next door and the piglets that are in the next crate and what have you. So these sort of things are important to look at, and that's what we discuss, when we discuss to acclimatize the gilts. This is a main part for, several diseases, but mostly in mind are for me now PRRS and Mycoplasma high pneumonia. And it's also the most difficult thing to get right. Next one, please. So then how do we vaccinate? So next one again. So most of the time only healthy animals. So if you've got an animal at weaning with a swollen joint, do include them. We're talking population medicine. There is one exception maybe to the rules. That is only when you've discussed this thoroughly with the vets and depending on what you want to achieve. If you've got an acute PRRS outbreak, sometimes it might be beneficial to vaccinate all animals in the phase of the outbreak, but animals that are sick and vaccinated with a PRRS vaccine will suffer a bit. But in the end, you will get quicker back to baseline production or healthy herd and what have you. But that's only after discussion. So normally only vaccinate healthy animals. Next one, please. And that is just because of what we said. If the immune system is already distracted, they won't give the same response to the vaccination as when they're fully healthy. So make sure you read the label from the manufacturers. We've put in a lot of research and done a lot of trials to get to make sure that we give it all at the right time. So if you hit the next animation, please. We need to think about the minimum age. So we already talked a little bit about maternally derived antibodies, and they can interfere with vaccination uptake, if you want to call it that way, because those piglets should have lots of antibodies floating in their bloodstream. So if you vaccinate too early, the mum's antibodies will just mop up all the vaccine antigens there, and the piglet won't respond in itself. So that's where we've done all the research and what have you. So make sure you stick to that minimum age. Expiry date, vaccines, most vaccines, I would say all vaccines, but maybe some companies have got different things, but definitely our vaccines, once they're expired, just assume they're not working anymore. You will lose your efficacy quite quickly. So don't risk the health and welfare and production of those pigs with going for something that's out of date. We're not talking about a day out of date, but I wouldn't go anything that's a week or more out of date. Once they're opened, again, that's our vaccine specific. Don't use them, a week later or something, because you've maybe only used half a bottle, you carry it over, because our vaccines do not have preservatives in it. So once there is air going into that bottle, we can get overgrowth with bacteria, mycotoxins, you name it. There are some vaccines that do have preservatives in it, and I know some reps are saying that it's okay to use them a little bit longer, but be very careful about which vaccine you can and which one you can't. But it's all in the data sheet there. And we're talking about best use here. There will be information in the data sheet of when not to use it. That means that either we haven't done the research on it, or we might have done the research but not submitted it to the health authorities, because to make a change on the data is costing us generally a couple of million. So make sure you use the correct dose as well, because obviously we do the minimum amount of antigens or parts of the box in a vaccine that we can get away with, that will still give us the good response and what have you. So if you go half dose, you're not going to get the protective level. So don't do that sort of thing. Just stick with whatever the data sheet says. And do not mix with different products. Oil and water don't mix. There's several oil products, there's several water-based products and what have you. Sometimes there's it's on the license on the data sheet that you can mix it, but if it's not on there, don't do it. Next one, please. So how do we vaccinate then? So again, if we just talk about the vaccine preparation, next one, please. Make sure you warm them up. We are talking most of the time about baby piglets here, so they're small. They might get a 2 ml if that comes straight out of the fridge. That is, quite uncomfortable, shall we say. But do not leave it out all night. If you take it out in the morning out of the fridge and you put it in the farrowing room and you come back an hour, 2 hours later, it's generally at a nice enough body temperature, or stick it in your pocket or something. Please don't microwave or boil it. It has happened, but the vaccine will not survive. You will still inject fluid, but it will be absolutely pointless. Make sure that your equipment works. Make sure that you've got the right guns that inject the correct volume. So do your checking. Make sure if you're supposed to give 2 mils, that the automated gun will still give a 2 mil dose. Make sure that you've got the right needles. So if you use the next slide here, so not all vaccines are given by needle, but some of them are. But if you are, so here are the different administration techniques. So we're only talking about injection by needle here. So if you go to the next one, but for oral vaccination, obviously you need to make sure you need to do some other steps. But if we're talking about needles, make sure that you've got the right thickness, which is the gauge. So that basically means the gauge stands for the number of pricks you can get on a certain surface. So the higher that number is, the more needles you can get on that similar area. So for baby piglets, generally we go for thinner needles than for older ones, but it depends a little bit on your product as well. So if you've got a very oily vaccine, you probably want to use a slightly thicker gauge. And the length is important as well, because we need, if we're talking about intramuscular injection, we need to make sure that it goes into the muscle. Next one, please. So it depends a little bit on where you give it, but as you can see here, in a baby piglet at 7 kilos, you can get away with a very thin needle, because the skin is very, very thin, obviously. So it's just a short needle will do well. When you're talking about sows, and if the skin will be thicker, you might have a fat layer, so you need a longer needle there. Next one, please. And then this is a question about how often do you change them. So just some pictures there for you. That's a brand new needle. Now this is a human needle, but it's still the same thing. And if you see the next one, you'll see after one needle, you can see at the tip of it, there's a little bit of a bend there in the top. And if you hit the next one and the next one again, you can see how badly that tip of the needle. You can't see this with your eye. This is under a microscope, but obviously that's going to be quite damaging. It's going to be blunt. It's going to be more trauma. It's also going to be a heck of a lot more painful. So do keep some consideration in how often you change your needles. Next one, please. So one of the things is, and again, is are you going to change them? If you're talking about healthy animals, is that in an ideal scenario, every animal, but it's not always possible. So keep it to a litter. If you're in farrowing, keep it to a room or a bottle, but obviously not when it's blunt, as I heard just yesterday. Sick animals are different, because we have to assume, if we don't know what's going on, but that there might be bacteria or bugs or what have you in that bloodstream. So a sick animal needs a new needle, or you only use that one needle once in a sick animal and not another once. Next one, please. And again, so make sure that you've got the appropriate pack sizes to minimize wastage, so that you're not tempted to carry over the vaccines. Sometimes you can, if you've got still 20 doses left, you can maybe got some kills that you maybe can vaccinate a little bit earlier or something, so they don't go to waste. But most vaccines come in very small doses, up to 10 dose bottles, so you really don't need to waste an awful lot. But your practice might not necessarily always store them. And make sure that when you do have to mix them, that it's done as aseptically as possible. If it's an oral vaccine, that's not important, because obviously whatever they eat is not sterile, but anything that you inject will be do that as cleanly as possible, because we don't want to cause abscesses and stuff. Next one, please. So we want to minimize stress. As we already said, stress will reduce the efficacy of the vaccination, or the efficacy of the immune system. So you won't get, if they're too stressed, you won't get this, a good response to the vaccine. Next one, please. So these are just a couple of things. So I don't like to use hind leg. So it's very easy to grab a hind leg and sling it up. There is only one ligament that sort of keeps the hind leg fixed into that joint. So if that gets stretched too much, that will do damage forever. There's also a couple of nerves and what have you that we don't really want to damage too much. We talk about the cradle grip and the calming grip we'll see in the next slide there. So these are all things that we can use to make the piglets more comfortable. So this is something that I don't like. So this is where we went in to do a sort of a vaccination audit. So this is what they were normally doing. So the pics are all loose. You can see in the corner there, they were about 4 or 5 high pigs on top of each other. The heat coming off them was tremendous. So these pigs are definitely stressed. And you can see what he's going to do there with that hind leg. That's going to put really a lot of strain on that hip joint, which is not great. So next, please. So we don't like next one. So this is something that we do like. So you can see we've got the piglets in their arm. You can see behind them as well, we've pent up all the animals. So there's not that stress that they're running around like mad. We're holding the pig generally. They feel secure, so they don't fight that much. We pull the ears forwards and we cover their eyes. So the pulling of the ears has got, apart from the fact that's part of the relaxing grip. If you hit the next slide, I think you will see that it will also expose a huge part of the muscle. If you hit the next animation, you should see a triangle coming up where we've got a nice big area where we can stick the needle in, which will not harm anything at all. Next, please. Reason why I go always for the neck, as you can see in there, is there's no vital bits there that we can do damage to, like unlike in the legs. It's also not a very valuable part of the carcass. Next one, please. Unlike the leg, is obviously very viable. So here you've got the risk of hitting bone, hitting quite an important nerve, and what have you. Plus, if you get an abscess in there, that obviously the ham is quite badly damaged. So we don't like this one either. Next one, please. And I think the next one again. So make sure you look after your pigs as well afterwards, because you need to have them at the right temperature, make sure that they've got food and water available, and check them regularly. So obviously, if you've got weaned pigs that are stressed because they have taken out of the normal environment, they're mixed in groups, so they're socially stressed, and what have you. They've also been vaccinated. If you throw them in a room that is maybe cleaned and disinfected but still wet, they're not going to be doing very well. So make sure all these sort of things are in place afterwards as well. Next one, please. So with the equipment, look after that as well. I know often, if you're vaccinating lots of numbers, you will just get new automated or multi-dose guns in for the next time. But make sure you do discard responsibly according to your local authorities, blah, 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 your unused vaccine. Make sure you clean and maintain your equipment. Make sure that you dispose of your needles responsibly, because we don't want anybody damaging. If you're gonna lubricate the rubber parts of your vaccination gun, do not use mineral oil, but just use vegetable oil. Next one, please. So then how to look after your medicines, because we now got them all, and there's certain things that are mightily important here because they cost a lot of money. Make sure, obviously, you check the data sheet, and that is, again, next one, please. That is, a lot of it is how you need to transport it and how you need to store it. Again, next of one, most important thing is that most of the vaccines need to be kept at 2 to 8 degrees. Some need to be kept in the dark. So make sure you refrigerate them. So don't just stick them in the fridge. You do need to plug it in as well. And it is your proper fridge, not your Siemens fridge. Keep that 2 to 8 degrees in there. Ideally, you've got a minimum maximum thermometer in there, so you can be sure that you have kept within that sort of time scale. Do not overstock your fridge. As you will know, your air ventilation is not going to be as efficient, and do not store it against the chill plate, because it will freeze, and once it's a slush puppy, it is going to be useless. So next, I think we'll see some pictures that we've taken from farms. So you can see how in the first big picture there is vaccines cramped all the way up there, also at the plate. So some of this vaccine was frozen. Certain things that you should never do is you've got feedstuffs in there with some bottles that are still connected to a gun. So I don't know what that actually is. And the next one, Lord knows what might be in that bottle next to the salad dressing, but it's not something that I would want to stick in a pig or anything else for that matter. So these sort of things are real examples that we see. So the last few slides then, what happens when it goes wrong, because things can go wrong. And as a company, we've got some legal requirements. So first of all, health and safety. So if you inject yourself, that can be dangerous. So you can do a allergic reaction or an anaphylactic shock to them, which can be quite instant, can be a little bit delayed as well. And that's quite a bad one. That will need some medical interference. Local reactions, you can get your stab yourself. So you're going to have some local trauma. You can introduce maybe an infection and what have you. But more importantly is that vaccines that have got a mineral oil in there as an adjuvant, you get some severe local reaction. What it does, it's tightens the blood vessels, and what surgeons generally, and I get these once, twice a year, I get the phone calls from emergency rooms that somebody's vaccinated themselves, and surgeons are really keen on taking off your finger, your hand, your arm, your leg, wherever you injected it. With our vaccines, we're fine because most of them don't have mineral oils in them, but do keep in mind, if you've got a vaccine with a mineral oil in it, do not ignore it, because people have lost naturally their own digit because they didn't go to the doctors. So next one, please. So when you do stab yourself, do seek animal medical advice. You can call your vet to make sure that you've got, that you know what's in the data sheet. Do not wait, because you could do an anaphylactic shock. So please don't drive yourself, because if you go into an anaphylactic shock when you're driving, you're not putting yourself at risk, but other people as well. Make sure if you go to the vets, you're not supposed to go to the vets, you're supposed to go to the human doctor. Make sure that you bring the data sheet with them, and make sure that you do report it to the pharmaco company like Boehringer or MSD or Zoetis or what have you, because we have a legal requirement to report these sort of things. Next one, please. So there's other things that can go wrong when we talk about the pharmacovigilance. So if you hit the next few ones, please. Some of these things might be a suspect lack of efficacy. So you vaccinated against mycoplasma and you still get pneumonia caused by mycoplasma. That is something that we need to investigate, and what have you. Adverse events are things like you inject the pigs and they start vomiting or they do neurological signs. Next one, please. Species that are not on the data sheet. So sticking a pig vaccine into a pig is fine, but we've got cases where maybe dogs eat human medicines or something. So these sort of things need to be reported as well. And we as a company have got a legal requirement to report that to the authorities. Part of that is to make sure that nothing has changed, that our vaccines are still safe. And there's some other things where we found benefits from vaccines if they were used off-label that will benefit in other unexpected ways. So next one, please. So whenever you do get anything that you do not expect when you're using a medicine, so whether that's a vaccine, whether that's a wormer, whether it's an antibiotics or what have you, call your vet so that he knows what's going on, because the animals might need treatment. Call the rep, the farmer, the rep of the company that's the product is for, and you can also report them on the NOAA website directly. That link will get you to the government website where you can download all the different bits and bobs. Next one, please. We're nearly getting there, Pat, so I hope you're waking up again. So the summary is, as we know, prevention is better than cure. If you need medication, because pigs will get sick, we all know that regardless of what we do, how well our prevention is, things will still happen. Make sure you use the right products at the right dose, as little as possible, as short as possible, but much as you need. So do follow your vet's advice there. Make sure that you use and store all medicine as instructed. If you don't store your vaccines at 2 to 8 degrees, there's no point even giving them. Next one, please. And make sure that whatever you do, work with your vet to optimize the health and the welfare of your pigs, and thus the profitability of your farm as well. And eventually, you make sure that you've got a sustainable farm. And I think that's it. Next one should be the any questions slide. Thank you. Any questions, Pat? That's you.
Thank you very much, Lysan. That was perfect timing. We've only got one question, and it's from a Mr. Andrew Palmer. And it is poor fridge management still a regular occurrence you see? And we'll have to keep the answer very brief because we're just about out of time.
Yes.
There we are. Couldn't keep it any more brief than that, Andrew.
Nope. I can go into details, but the short answer is, unfortunately, yes.
And that is very disappointing, isn't it? when it's something
Yes.
very, very simple to do.
Yes, and it's not just on the pig side. We know from the cattle sides, just generally vaccine use. This is a study about 5 years ago or so. For the BVD vaccines, only 45% of the user used them appropriately, and that included fridge fridge temperatures and all that sort of stuff. So yes, pigs really doing a lot better, but fridge temperature is still a big thing.
Super job. Right. Well, thank you very much, Lysan. That was very, very useful and very interesting.
Good. You're very
And
welcome.
so that brings tonight's webinar to a close. Thank you very much.
Thank you.
Hope to see everyone again before too long.
And if anybody's got questions, you've got my details there, so feel free to get in touch.
Brilliant. Thank you very much.
Thank you.
Cheers.
Bye.
Bye.